Are you fasting right now?
Yes. Nah, really?
Do you celebrate Ramadan?
You're not eating food? Is this Ramadan?
Yeah, it's Ramadan.
Yesterday. Do you celebrate Ramadan?
Wait, yes. I am Muslim, right?
You're not Jewish.
They do try to make autumn or a lot of Jewish law. All right,
Oh God.
the heart. What do you know about it?
It can literally break. If you are really like sad and somebody breaks your heart, you can actually break it.
Okay, you can actually die of a broken heart.
Those are
Fact. Yep, fact. Huh?
The heartstrings, like too much stress is on them, and you can pull apart and it can like cause a bad things.
The heartstrings. So based on what you looked at yesterday on any of those worksheets, huh? Based on what you looked at yesterday on any of those papers, where would you suspect the heartstrings are? Hmm? You didn't see any? All right. So what do we know? We know we need our heart to pump the blood around our body to deliver oxygen and nutrition to all the cells so that they may perform their functions. We know that we have arteries that take blood away from the heart and veins that bring blood back to the heart at the cellular level where we have osmosis and diffusion going on. That happens at the minuscule capillary level. And then all the waste that the cell creates from their body processes get picked up by the blood, brought back into the central circulation so that we can get rid of those wastes whichever way we need to. And there's multiple ways. So the lungs will get rid of carbon dioxide, kidneys and liver will help get rid of the rest of the stuff. And then our lymph system is a supplement that helps make sure any fluids that live in and around the tissues make their way back into the central circulation the way they're supposed to. So looking at this dude, if you look at him, you can see that he is a network of red and blue lines. So the red represent arteries that take blood away, and the blue represent veins that bring back. This is what you call your systemic circulation or your general circulation, meaning it covers your whole body. When we look at 14 later in the week, you'll see there's other sub-circulations like mother-baby circulation, like cardiopulmonary circulation. They're like their own closed circulatory systems within the circulatory system. But generally speaking, we talk about the circulatory system as a whole. We know that as blood is delivered to the tissues and that gas exchange and that nutrient exchange happens, that the actual composition of the blood is changing, and the blood that comes back from the tissues doesn't look exactly the same as the blood that left the heart because we've dropped some things off at the tissues and we've picked some things up. Does that make sense? Questions? All right. So the heart, if you make a fist with one of your hands and you put it in the middle of your chest, that's about the size of the average heart. The heart is midline, meaning it's in the middle behind your sternum. It is not to the left like most people think. The reason people think it's on the left side is you see how it kind of points left here? That is a big piece of muscle right there. It's called the apex. That's where you can hear the heartbeat the loudest. So you do hear the loud heartbeat off to the left. So it's above the diaphragm, sits between the lungs, surrounded by its own membrane, the pericardium, to protect it. And there it is, and surrounded by the great vessels. We know, we've learned this 100 times, after 4 minutes we can have brain or myocardial tissue damage without oxygen. I'll introduce you soon to a stethoscope. This is the mechanism by which we listen to heart and lung sounds, take blood pressure, etc. Cardiac arrest is when the heart no longer beats. It also is the same exact thing as what we know as biological death. So biological death is what most people refer to just as death, meaning there's an absence of heartbeat and respiration. If that happens, you're a good candidate for CPR, which we'll learn next year. Yes? Okay. So here's what the wall of the muscle looks like. The outer layer, the fibrous layer, this is your pericardium. This is the very tough sac that protects the muscle within. Then you have 3 layers of muscle. So most of the time, that's unimportant, like on the day-to-day, but when it becomes important is when one of 2 things happens. So the big layer of muscle, where's my mouse? There it is. This big layer of muscle here, this is the myocardium. This is the workhorse part of the muscle. This is the part that does the contracting to help the heart pump. So if there's any reduced blood flow to the myocardium and you have damage to the myocardium, it affects the way that that muscle can contract and relax, so it affects the way the heart can pump. The other time it's important to know your layers is sometimes here, this endocardium. This is the smoother inner lining part of the muscle. When people get a bloodstream infection and the blood is being pumped through the heart, it can end up infecting the endocardium of the heart muscle and cause a lot of severe medical problems. So people who get an infection in the bloodstream are at very high risk to have that infection go into that inner layer of the heart muscle, and it can cause a whole bunch of problems. Does that make sense? Because the blood's circulating right through there all the time. Blood comes back to the heart and leaves the heart through what we call the great vessels. The great vessels are the great big ones that you can see with the naked eye if you were to open someone's chest. So the blood comes back from the circulation by way of the vena cava. You have a superior, which means above, and an inferior below, and they both empty into the heart. Then the aorta is the big blood vessel that takes the blood away from the heart and takes it out into the circulation. The coronary sinus, so if you look at this one, you see this little blood vessel right here? So this big doodad here is the aorta. This little guy here is a coronary artery. So the coronary artery has to take blood to the heart muscle so that the heart muscle can pump blood to the rest of the body, right? So that heart muscle is working hard, so it needs a constant blood supply too. So that there's a little tiny hole right off the aorta as it exits, and it feeds blood to the heart muscle. So that's the coronary sinus. And then the circulation from the heart to the lungs and then back to the heart again is also very important. So that is here, you see you got your right pulmonary veins over here on the left, and the pulmonary artery. Does anybody notice anything wonky here? That's fat. Most people have some fit layer. Some people have a lot of fat around their heart, but everybody has a little bit. So what I see that's different is, didn't we just say a few minutes ago that arteries take blood, oxygenated blood away from the heart, and veins bring deoxygenated blood back? It's pretty factual, right? Look at the pulmonary artery. If I can find my mouse. Look at it. It's blue. Why is it blue? But it's an artery.
Blue inside of us?
It's not blue, it's red. It's just a visual representation so that you can take away which blood has oxygen and which blood doesn't. But I promise you your blood is red, it's not blue, okay? So interestingly enough, the only artery in your entire body that carries blood without oxygen is the pulmonary artery. And the only veins in your entire body that carry oxygenated blood are the pulmonary veins. They are exactly opposite of how most of the circulation works because of the way the cardiopulmonary circulation flows. I'm going to show you that in a minute. All right, so here's a quick snapshot of what it looks like inside the heart. So this is the aorta. So the aorta is the greatest vessel in your body. It's a very high pressure vessel because when that heart pumps the blood out to the circulation, that's where it goes first. And then you can see it'll start to branch. It'll branch in all different directions and carry blood into the rest of the body. The vena cavas are here's the top, here's the bottom. They kind of come together at the right side of the heart and bring the blood back from the circulation so the heart can circulate it to the lungs to get more oxygen. Again, here's the pulmonary artery. And I'm going to explain to you guys a little bit about how the blood flow happens through the heart because it's kind of a strange concept. Our heartstrings, they're right here. They're actually called chordae tendineae. In your ventricles, which is the bottom part of the heart, these hold the valves in place and help work the valves and keep the blood going the right direction. The heart's divided into 4 chambers. Right and left sides, each has an atrium and each has a ventricle, the atriums being the top half, the ventricles being the bottom. And I think that's that. And then the middle wall, what do you think this is called? Septum, right? So when I say you have a myocardial septal defect, does that make a little bit more sense now? Right? Because you do have a septum that runs between the right and left side of the heart. All right, we said this. Upper chambers, so the tops are the atrium, bottoms are ventricles, left and right. Can you get the door? You have valves in your heart. Valves work, they're one-way valves to keep the blood flow going in the direction that it's meant to go. If those valves do not function properly, blood can back up. You ever have a drain back up the wrong way? Same thing can happen if your heart valves aren't working right. The blood can back up in places where it's not supposed to be and cause all kinds of problems. We're not going to get deep into valves. You have two different types. You have the type that separates the top half of the heart from the bottom. Those are your AV valves. And you have semilunar valves that separate the heart from the circulation. But that's all you need to know about valves. The heart is a pump. The heart functions as a double pump. Each side has its own job to do, even though it does beat in synchrony. And I have a little video for you here. Oh, I forgot.
It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of four major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again.
What if it switches?
You can't. I mean,
With like.
The heart has four valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve
peekaboo.
and close to prevent blood from flowing backward.
Sorry, couldn't resist.
The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta.
We'll stop here because we have a thing on this later. So that's a very brief synopsis of heart pumping blood in and out of the vasculature and how the valves are one-way doors keeping everything moving in the right direction. So everybody has their own normal heart rate. As a rule, the normal adult heart rate is around 70 to 80, with the range of normal being from 60 beats a minute to 100 beats a minute. The way you measure how much blood your heart's pumping is your ventricle, that bottom part of your heart, has a certain amount of blood it can hold, right? I mean, just like any other thing, this cup has a certain amount of liquid it can hold. So does your heart. Everybody's is going to be a little bit different, and there are factors that affect how much filling happens during the filling part. But if you multiply the number of milliliters that the heart can hold times the number of times the heart beats, that'll give you an idea of how much blood is circulating through your body each minute. Those calculations in most places don't get any attention. They get a lot of attention in specialty populations like cardiac surgery, ICU, people in shock. This is where this stuff comes in handy. You know the heart makes lub-dub sounds. So those valves that we were just showing, when they open and close, they kind of snap. And that's the sound you hear when you listen to somebody's heart. And so one sound is one closing and the other one is the other closing. Your heart has an electrical system. Your heart has an electrical system, a mechanical system, and a plumbing system. So the electrical system is what makes the heart beat. So remember we did nervous system and muscle. We said the nervous system has to have a contact with a muscle to give it an impulse for that muscle to contract, right? Anybody remember any of that? No? Yes? Okay. So for a muscle in my arm to contract, it needs the nervous system to send a signal, right? Right. Your heart muscle does not need that because your heart has its own conduction system or its own impulses. Your heart is able to make its own impulse to stimulate the heart muscle to contract without any help from the nervous system. So in the top part of your heart, in the right top part, you have this thing called an SA node. And that piece of cardiac tissue generates an impulse that makes the heart depolarize and contract and beat without any help from the nervous system. There's a pathway that electricity is supposed to follow so that things happen in the right order. And when that gets screwed up, that's when people need like pacemakers and have either super fast heart rates or super low heart rates or other kinds of rhythm disturbances. But if your heart's working the right way, that SA node will fire and make your heart contract on time as it should without any other system in your body having to intervene. Good? What is wrong with y'all? All right, so here you go. Here's a picture. So way up here in the top of the right atrium is the SA node. Now, some people have a heart attack or have some other medical problem where their SA node does not function properly. So what do you think happens if the SA node doesn't fire that impulse?
It doesn't beat.
Doesn't beat, except your heart has a couple backup systems. So you have another node that's capable of making an impulse here called the AV node. The regular job of the AV node is to kind of slow down the electricity because you got to remember the electricity functions to create something physical and mechanical happening, right? Because we need the electricity to go through the muscle so the muscle will squeeze. So the muscle squeezes as a result of the electricity. So the SA node fires, this muscle gets ready to squeeze in the top. Then it goes through the AV node to get ready to have the bottom part squeeze so the body can pump the blood out. If the SA node does not fire, this AV node is capable of making an impulse. The interesting thing is that they all fire at different rates. So for example, I told you the normal heart rate is 60 to 100. So this piece of tissue right here is capable of firing between 60 and 100 times per minute. In the event that that one does not work, this piece of tissue here is capable of firing at 40 to 60 beats per minute. So this one will never get a chance to fire if the other one's working properly. Does that make sense? Because it's always going to be overruled by the one that beats faster. Now, in the event that you're really having a bad day, and this one doesn't fire and this one doesn't fire, the ventricular muscle, it has some electrical cables running through it. It also has the ability to make an impulse and cause a contraction, but it will only fire at 20 to 40 beats per minute, and it will only fire to the tissue around the bottom of the heart. So it's not a good condition to be in. So your heart, throughout all the tissue, is able to make its own electricity to ensure that that muscle contraction that we need to live can happen. Are we clear on what I'm saying, or just wanting me to be finished? Both? Okay, that's fair. All right. So this is kind of how the electricity is supposed to look when it runs through the heart. This SA node here fires. The electricity goes down through the AV node, and you can see how it travels through the bundles, and so that's what causes the contraction.
Action potentials originate in the sinoatrial node and travel across the wall of the atrium from the sinoatrial node to the atrioventricular node. Action potentials pass slowly through the atrioventricular node to give the atria time to contract. They then pass rapidly along the atrioventricular bundle, which extends from the atrioventricular node through the fibrous skeleton into the interventricular septum. The atrioventricular bundle divides into right and left bundle branches, and action potentials descend rapidly to the apex of each ventricle along the bundle branches. Action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. The rapid conduction from the atrioventricular bundle.
See how that happens? Top electric squeeze, bottom electric squeeze. Has to happen that way or the blood won't go where it's supposed to go. Did you see too how the electricity, as it came down from the top part of the heart to the bottom part, it made sure that it went to both the right and left ventricles? Ooh, hello you, not this guy.
It's probably the most.
Huh?
It was the thing that popped up inside.
Our heart is an important component of cardiovascular system.
It creates pressure every time it beats.
This is just a.
This pressure moves the blood
We
to
should probably
every
mute
cell in
this.
our body.
So I get.
Yeah.
Look, it's a good a good visual of the cardiac cycle and how it works. So every time your heart beats, it goes through a complete cardiac cycle. And the part where it squeezes, the part where it squeezes is called systole, and the part where it relaxes is called diastole. So during systole, the squeeze part, that's when we pump the blood out. What do you think happens during the relax part?
Calm down.
Okay?
Calm down.
What comes down?
Yo.
So during the relax part, those heart chambers have to fill up again, or there won't be anything to squeeze the next time, right? So it's contract, relax, and fill. Contract, relax, and fill. Anybody know what the numbers on your blood pressure are?
Yes.
What's the top number called? Bottom number called?
60. No numerator.
This is not that class. Okay. No, your blood pressure is measured systolic pressure over diastolic pressure. So the pressure on the top number is what's the pressure in your arteries when the heart squeezes, and the bottom number is what's the pressure in your artery when the heart relaxes. Huh. Okay. As we get old, everything sucks. So the muscle gets fibrous. It doesn't pump as effectively. You can have a lot of conduction or electrical problems in your heart, and you can have some significant medical conditions from poor lifestyle. Heart disease is one of the leading causes of death for men and women in the United States. There are a lot of risk factors to developing heart disease. What we have learned over time is that a huge component of heart disease is related to genetics.
The muscle that continually pumps blood to the rest of the body. The coronary arteries supply the heart itself with the necessary oxygen and nutrients it needs to function effectively. Red blood cells, white blood cells, and other substances flow freely to the heart and other parts of the body.
See those
In a healthy
fats floating
person,
around?
The walls of the artery are smooth
These
and
are trouble.
uniform in thickness. Over time, however, a high level of circulating cholesterol can cause fatty deposits called plaque to accumulate. As plaque is deposited, it can harden and cause the artery to become narrowed and less flexible, a condition called atherosclerosis. If atherosclerosis develops in the coronary arteries, the condition is called coronary artery disease, or CAD. If blood flow is severely interrupted, a myocardial infarction can occur. A myocardial infarction, or MI, is another term for heart attack. If blockage of a coronary artery exceeds 90%, the risk is increased.
Yep, so that's the fatty plaque
The risk is
building
almost
up in
certainly
artery, and see how this
5%
diameter is getting less and less? So it becomes harder and harder for the blood flow to get through.
So like
Is
the
by the
heavy,
development of a
heavy
blood
setter
clot.
or like the
Oftentimes,
It's not necessarily heavy setter.
plaque
It
buildup.
has a lot to do with
When
diet,
this happens,
exercise, and
blood can
genetics.
coagulate or clump together at the site of the crack. Or
You
a
can,
blood
yeah.
clot called a thrombus
So if you have chronically
can
high
blow
cholesterol and
completely
stuff
block
like that,
the blood flow.
this is what's going on in your
The
arteries.
extent of damage sustained by the
And then
heart
all it
during
takes
MI
is one little
depends on the severity
clot
and
that can't get
location
through
of the
there,
block
and you block
and
the
speed
circulation
at
to your
which
heart.
medical treatment is received.
you die.
Fortunately, there are
Potentially,
ways to
depending on
prevent
which one is
atherosclerosis
blocked.
You get a heart
and to
attack.
lower the risk
Yeah, that's what
of
causes a heart attack. Yep.
Do this thing like take out the fat like every now and then.
Well, not every now and then, but in the event that you have an acute heart problem. Hang on, I gotta get rid of this other one. I don't know what that is. I'm so good at this. All right, there we go.
The map looks, I'm telling you.
Okay. So in the event that that coronary artery is blocked, no blood flow is getting through to the heart muscle. So if something like that happens and you're in the hospital, they can do a procedure where they put a catheter in and shoot dye to see what blood's getting where, and then they can potentially do intervention. they don't just randomly go intervene for mild blockages. They only intervene in places that are causing significant symptoms or a heart attack. So there's a lot of less invasive options to kind of clean out those arteries that are what we would call catheter based, meaning that they would like poke you in the groin and run a catheter up as opposed to doing an open surgery. So so cardiac cath, angiography is the most common. So angiography is using x-ray to take images when you put the dye up through the coronary arteries so we can see what's going on. And then it gets progressively more complicated from there depending on what your problem is. So there's a slew of tests that we can use to figure out what's going on with your heart. Cardiac catheterization can be just diagnostic, or it can then have an intervention component if the person is having a significant blockage that is causing symptoms. And then these IVUS, this is a neat thing that we started doing when I was working in, it was new when I worked in cardiac surgery. It's actually a microscopic ultrasound that's on the end of a little tiny catheter that they can float in your arteries, and they can actually ultrasound the inside of those coronary arteries, which are tiny, like tiny, tiny arteries. So that helps give a lot of perspective as to what's going on inside the artery and how to help the patient. There's a lot of blood tests that can be done to give us information about how your cardiac health is. The BNP helps us know if the heart's pumping effectively. Lipid and C-reactive proteins help us decide if you have a lot of risk to developing heart problems. And troponins are enzymes that are leaked out of the heart muscle when it's hurt. So if you're having a heart attack and you go to the hospital with chest pain and they check your blood work, they're going to look for these enzymes to be spilled in your blood because your body does spill these enzymes into the bloodstream when the cardiac muscle is being injured. We're almost done, guys. Common diseases, arrhythmia. Arrhythmia, what's the core word in there is rhythm. So that means your heart rhythm is screwed up. So when your heart beats, it should be very rhythmic and regular. 1, 2, 3, 4, 5. Some people have conduction problems in that electrical system where the heartbeat gets really offbeat. Sometimes can get super fast, slow. It can vacillate between fast and slow. Slow being Brady and fast being tacky. Murmurs are noises you hear with the stethoscope if you listen to somebody's chest, and they have a heart valve that's not letting the blood flow through properly. So if you listen to somebody's heart and you hear a different kind of sound instead of just the regular lub-dub, that's the first clue that they may have a valvular problem. Coronary artery disease we just talked about, that's when you get the blockages and can lead up to a heart attack. Angina is people who have mild blockages and will intermittently experience chest pain, but they don't really have a heart attack. And then MI is when everything's blocked. Infectious diseases of the heart, the main one being endocarditis. Endocarditis is common in IV drug users. Oh, okay. You're going out of exile now? Okay. Because they often use dirty needles and get bloodstream infections. And so they can get an infection on the inside lining of their heart and their valves, and they can end up dead or significantly disabled. So those are the ones that, the valves are the ones that are really high risk when you have infectious processes going on. All right, heart failure. So sometimes building muscle isn't a good thing, right? Does that make sense? No, it makes no sense because what you've been told. Be strong, pump your muscles, make them bigger. When you make the heart muscle work hard and pump harder, and that muscle gets bigger, it doesn't get better. It gets better for a little while, and then it starts to really get worse. So people who have, like, let's say me, high blood pressure, my heart has to pump harder than your heart to get the blood out of the heart and into the circulation because the pressure in my arteries is higher, right? So if my blood pressure is 160/80 and your blood pressure is 120/50, whose heart's going to work harder? Mine. Because mine has to overcome that pressure to get the blood out to the body. So the heart gets tired of doing that, right? So as the heart gets tired of doing that and the heart muscle gets bigger, look what happens. It doesn't get bigger outside. When that heart muscle wall starts getting bigger, it gets bigger and starts taking up space where blood should go. Then things just get bad. So this is when people say they have heart failure or congestive heart failure. This is a pump failure. So you can have failure of the plumbing. That's when you have a heart attack. You can have plumbing of the or failure of the electricity. That's when you have conduction or rhythm problems. He'll be fine. And then you can have failure of the mechanical pump, which is when people develop heart failure. Do you get the difference, guys? Yes or no? Or are you just all dead? Anyone? No, I'm all by myself here? Okay, you get some of it. Alright. Alright, so and then of course there's all different kinds of surgeries and treatments that you can have. And I have reached my threshold for this. Questions? No questions? Cares? Gotcha. No one cares. Huh?
I don't get it.